Hello, good evening, everyone, and good day to all of you. It's again amazing to be back with all of you. Welcome to our IVF webinar. And as you can see, we have another special guest tonight, and we definitely have a very interesting and also, I would say, still difficult topic, which is not often discussed. And I'm very, very happy that we are able to bring you this topic tonight. And as you can see, Dr. Margarida Fonseca is with us right here. Hello, how are you feeling tonight? It's great to have you here.
Hi, Caroline. Thank you for having me.
Thank you so much for joining us tonight, spending this Friday evening with us as well. And thank you also for just preparing the presentation. I've already seen it, and there are plenty of information, and I'm sure you will find it useful. As I mentioned, our topic tonight is definitely something that is not discussed enough. So we will talk about single women pursuing infertility treatments, and of course, Margarida, she will tell you all about this. And let me just mention that she is the psychologist at a clinic in Portugal, Coimbra, Ferticentro. And it's amazing to have one more team member from Ferticentro. We already had Dr. Vladimiro, Patricia was with us before, and now another team member from the clinic is joining. We are definitely excited to have you here with us tonight. And as always, we will start with the presentation, but afterwards, don't forget there is a time for your questions, your comments, anything that's on your mind. You will be able to type this in the chat section. And of course, Margarida will help you out. No doubt here, she will do her best to help you out with anything that you might want to ask. And yes, I think let's go ahead with the presentation. I'm already looking forward to see what you will be talking about here as well. So, ready, Margarida?
Yes, ready.
Wonderful. Thank you so much then. And let's.
Thank you. Let's do it. So, hi everybody out there. So, my name is Margarida. I am the psychologist at Ferticentro, a fertility clinic in Coimbra, in the center of Portugal. I'm here today to talk about how and where can single women pursuing infertility or fertility treatment find support emotionally, socially, and medically. So I hope this presentation will help you, and I hope you can take something from it to you. Okay. So after this presentation, I hope you will be able to understand single motherhood in the context of assisted reproductive technology, to acknowledge the profile of single mothers by choice and the decision-making process of becoming a solo mother, and to learn about medical, social, and emotional support during the process. So first of all, what is single motherhood in assisted reproductive technology? So this is a kind of motherhood project in which a woman, whether hetero or homosexual, decides to have a baby without a partner with the help of assisted reproductive technology using sperm donor, the so-called social infertility, where the woman has reproductive capacity but does not have or does not want to have a partner. So science has the possibility for women to use sperm donor to become solo mothers. When women have some kind of reproductive impairment, they might need not only a sperm donor, but also an egg donor. This is social and genetic infertility, okay? It can be done by double donation or by embryo donation, okay? It is worth of note that single motherhood by choice in art is different from single motherhood by circumstance. For instance, single motherhood after death of partner, unintentional single mother after an unplanned pregnancy, single motherhood due to separation and divorce, or after adoption. So this is completely different contexts, because in single motherhood by choice, you start from the beginning, you choose to be a solo mother, and the intention is different, the context is different, you are on your own from the beginning. So this will ultimately impact the mother-child relationship. So I don't know if you know Emma Brooks. She's a British author and columnist for The Guardian. She is like a pioneer of single mothers by choice. She even wrote a book, which I recommend, because she has a very delightful story, a very delightful path of becoming a solo mother. And she says something very interesting, which I really understand and even support. She says that the hardest thing about having a baby alone isn't the expense, the fear of the loneliness. It is in the process of getting pregnant, with its cycles of raised and dashed hopes, or the term sperm donor with its unsettling connotations. No, the hardest thing about having a baby alone is making the decision to do it. So actually making the decision is really the hardest thing that you will come through, and that's where us in fertility clinics must help you with, because the anticipation and the anxiety of making the decision is actually a source of more suffering than actually the hardships that come with solo motherhood. So, what are the challenges of single motherhood by choice? I identify three greatest challenges, in my opinion. It's finding structure within your own self, finding your emotional structure to do it, and the social support, social structure. Then you'll have to choose the clinic and then choose the donor. And this will all impact in the decision-making process. In order to help you, you will need medical, social, and emotional support to face these challenges. And that is actually what this presentation is all about, to help you understanding these challenges and where can you find help you finding support. So first of all, I think that when it comes to medical support, you need to find a clinic with from whom you'll have empathy, a balance between empathy and competence. You'll need to build a relationship, a strong relationship of trust, and you'll need to have clear information provision. So these are the three basic features that you need to find in a clinic. So first of all, I will advise you to find a clinic or a doctor with whom you can build a strong and unconditional long-term relationship of trust, because the clinic will be part of your path to becoming a mother. So it is extremely important to choose wisely. Art can take some time. It can take, we don't know how much time it will take. There are no absolute certainties, there are no guarantees, we never control the outcome, so you'll really need to trust the process and the team's decisions, okay? This is extremely important. It is also important that the medical team provides you with clear information about the whole process and how the clinic works. For instance, how donors are assessed, the steps of treatment, the limits of donation, what to expect during the process, etc. This is something that you really need to ask for. Also, I recommend you to establish upfront how you would like to be treated and what are your needs. Some patients like a more formal communication, others like more informal. Others prefer more empathy and warm, a more empathic and a warm approach. Others would like a more pragmatic. Some patients like to have more technical information. Others like information to be really simple and really easy to understand. Some patients like close contact during the process in order to feel more at ease, while others only like contact when extremely necessary. So please tell us how you want us to treat you. Also, I think it's important for you to ask for help understanding the meaning of epigenetics and nature versus nurture, because genes are extremely important for basic traits like eye color, but nature has a greater influence on personality and to impel some genes from expressing. So it's important to understand what's behind genetics and what it really means, donation. And lastly, I would recommend you to ask for help when choosing the donor. So choosing the donors is actually a really big challenge for some women. So I wrote down some recommendations to get you started. I always recommend patients to scroll down some donors databases, okay, in order for them to get familiar with donors profiles. You can search for donors in, for instance, Cryos, European Sperm Bank, and Ovogene Bank to have a more clear picture of what kind of donors are out there. Our patients at Ferticentro, they might choose donors from our gamete bank, which are assessed and selected by our clinical team. And our patients can also choose from the mentioned banks. So it's really the patient's decision. It is important to set your standpoint and position in the process, okay? Because some patients tend to see donation as only cells and genes, while others humanize the process and see the person behind the scientific and medical procedure, okay? So this is different perspectives. There is not a correct perspective. They're just different. Also, some patients trust the clinic to choose a donor, while others like to get involved in the selection process and to feel they have some control over something that is so important in their lives, especially when other aspects of the treatment are way out of their control. So again, please tell us, how would you like to take this? It is important to manage expectations, okay? Because there is no perfect donor. There is no candidate that is exactly like how you would like them to be, nor a donor like you, okay? You might find some common grounds and pleasant traits on a donor, but there will always be features that you don't really relate to. It is important to remember that donors are people just like us, and imperfect just like us. Also, you must choose the amount of information you would like to have on the donor, because some people, they prefer the least information possible. Some would like to have a basic profile, and some would like to have the most information possible. And you can also ask for examples to the clinic and get familiar and see what works best for you. You might like to prepare a donor profile. This is basically to help us to narrow down our database, okay? Because then we will know what you really want in a donor, and what kind of features you would not accept at all. But we can also help you do this, okay? So this is not something that you're really supposed to do on your own. This is just something that we can help you. So I guess that choosing the donors, it gets easier if we give you some information about them. So about our egg donors at Ferticentro, they range from 18 to 35 years old. They are mostly Portuguese and Brazilian. And Brazilian donors usually have some kind of Italian, Japanese, Portuguese, or German ancestry, okay, or indigenous ancestry also. The majority of them are students or workers. We have a lot of students because we are located in Coimbra, which has famous university. So our donors, they have university studies like nursing, psychology, engineering, marketing, law. They might be studying one of these courses. And we have also high school graduates. Our donors are mostly motivated by sorority, okay, even if sometimes there is an economical interest, for instance, to pay for their studies or to pay for their children expenses. There might be an economical interest, okay? It's very, very rare to find a donor that is only exclusively motivated by economical interests, okay? Because the process is really hard to do and the compensation is not really that high. It's 878 euros at the moment. It's the amount of money is defined by is established by the government. So regarding motherhood attitudes, our donors have different perspectives. Some of them are already mothers and they wish to give the opportunity to other women to feel the same joy as they feel being mothers. Others don't want to have children at all, and they feel that it's they are losing and wasting all sides that that could be of use to somebody else. Also, some of them have a sense of common good, and they feel it's their duty to do something for others. Or also, some of them they might also they donate because in the future they might also need. So while they're healthy, they want to donate. Regarding our sperm donors, they range from 80 to 40 years old. They are mostly Portuguese and Brazilian, as well as the egg donors with some European or Asian ancestry. They are mostly students or workers like firefighters, military officers, musicians. They might have university studies like engineering, sports, management, or they can be high school graduates. Regarding their motivation, the majority of them has a benevolent motivation, and or they believe they have good genes to pass on, okay? In terms of fatherhood positioning, they are really consistent. They are not like our egg donors. Some egg donors don't want to be mothers at all, but our sperm donors, the majority of them are already parents, or they have a great wish to become parents one day. They are usually very nurturing and very paternal. So this is also an important issue regarding choosing donors. Patients like to know how are they selected. So at Ferticentro, our sperm donors, they start with a spermogram, okay? This is the first step of donation. Of course, they need to register on our website, and we call them. They need to do the spermogram. The spermogram needs to be okay, needs to be normal. Then they follow to the clinical assessment, comprised by medical, nursing, and psychology appointments. They need to be healthy to have a normal BMI. They need to be psychologically fit, of course. After being approved by the doctor, the nurse, and the psychologist, they will do the genetic and STD screenings. Recommended. We follow the recommendations of the international scientific societies. Then, after approval of these results, they will start doing the sperm donations, usually 5 to 7 donations. And 6 months after the last donation, they will repeat they will do the retest of the analysis. And then they can be used as donors in they can enter our database, okay? So this takes actually 7 or 8 months from the start of the process until a donor is fully approved to help our patients. Then we will prepare their extended profile in order to present them to patients. About our egg donors, the process is quite different. After registration, they need to do the clinical assessment. They just like the sperm donors. They will do a genetic and STD screening. And then they will start ovary stimulation and oocyte pickup, and they will have medical, nurse, and psychology appointments during the process. So the whole process can take about 1.5 months or 2 months to be complete. So it's much more faster than the sperm donor process. So when it comes to the psychological assessments, what is actually the role of the psychologist with donors? So first of all, is to assess donors' mental state and psychological functioning. We need to assess their ability for the donation process, their openness, their commitment, their collaboration, responsibility, knowledge of the process, expectations, insights, awareness. We might need to do some psychoeducation regarding coping strategies, emotional processing, etc. Of course, we need to manage their expectations about the process, the length, the exam results, treatment cancellations that might occur, and we offer emotional support when needed. Sometimes I offer my direct cell phone contact when I feel that they need some extra support. So basically, it all really starts with donors, and it's very important that we protect donors and ensure that they donate with safety in order to guarantee that the process starts from a good place. So after this first assessment appointment with donors, at Ferticentro, we make the decision to approve or not approve the donor. We make the report about the donor. Then, if the donor is approved, we will prepare the extended profile to deliver to patients, and then we will have follow-up appointments in every donation, and when they start, every time they start the stimulation, or when they need, of course. We follow a humanist and holistic approach at Ferticentro. We offer them free psychological support during the process, whether it's for something related to their personal lives or related to the donation, it doesn't matter. It's just important to guarantee that they feel supported, calm, and safe during the period of donation. So, after assessing a donor, we prepare a psychological report, and the parameters of this report, they comprise many aspects. It is actually a long report, very thorough. So we analyze the context of the donor and the motivation, their expectations about donation, their personal and professional situation, their support network, their self-care and health habits, psychological, psychiatric, or neurological history, perceptions and attitudes towards non-anonymity, children and attitudes towards parenthood, message to the recipients. I always like to ask them to write a message for the recipients, their psychological functioning, their personality traits, behavioral observation, because like 80% of human language is nonverbal. The results of psychological tests. We do some psychological testing for anxiety, depression, and overall psychopathology. And then we have the final assessment, and the donor can be considered to be fit, not fit, or might need a reflection period, or also might consider to be excellent. So based on this report and based on clinical information, we will prepare the extended profile. This is basically all the information that we have about donors that we can deliver to patients. The extended profile is comprised by 2 documents. The first one has clinical information, basic physical features, analysis and genetic exams that the donor has done, medical procedures, and genetic screening tests. The second one has detailed physical features, is more extended, the second one. The first one is more basic. And patients can choose whether they want to receive the first one or both of them. And as I was saying, the second one has detailed physical features, education, training, and occupation information, personality traits, family tree, message to the recipients, values, life goals, and random information like favorite food or favorite movie, and those kind of informations. So that was it about medical support. Now about social support. This is actually very, very important in single motherhood. Of course, the basic social support is starting from asking for help to family, friends, neighbors, work colleagues, teachers, but they might not exist, okay, or they might not live nearby. They might not be supportive also of solo motherhood by choice, or they might be overwhelmed by their own lives. They might not be available to support the woman. So my advice is for women to build their own social network, okay? Find other single moms or single parents and create your own social environment. This is extremely important. Also, you need to play an active role in society and educate on your legitimacy to become a single motherhood. So you really have the right to become a solo mother, and society might not be prepared for it. They might react with some askance, with some skepticism, distrust, and criticism. But these are actually a reflection or a projection of their fears, their fears of people who don't know you and who don't impact on your life choices and values. So it's basically something that will not impact on your life. While making the decision, I will advise you to talk to other solo mothers, like Emma Brooks, for example, or like Mel Johnson from Stork and I. They really made a great job by putting themselves out there and talking about their paths. So they have really inspiring stories, and you can talk to them and see what can you learn from them. You can also look for books, documentaries, and testimonials on relevant issues. I give you 3 suggestions here. To a documentary on Netflix called 3 Identical Strangers. The Call to Courage by Brené Brown is very inspiring. It's on Netflix also. And a testimonial on YouTube from a donor-conceived child, which is very, very, very inspiring to hear. It might help you a bit. So finally, regarding emotional support, I would say that emotional support comes from, there are many pillars. There are some pillars of emotional support. The first one, I believe, it's self-awareness and self-knowledge. Self-esteem will be another one, self-care, emotional regulation, and psychotherapy. I will address each of these. So how one actually builds emotional support. The first step is to be aware of your psychological functioning. We might have some self-criticism, some rumination thinking, some limiting beliefs, and this can impact our decision making. And it's important to really align our decisions not on our fears and not on our dysfunctional patterns, but with our intentions and with our life values. Values are like a GPS on our lives, okay? They help us make tough decisions and live a fulfilling life, even if things get rough, get tough, if we feel pressured by society or if others don't support us. So values are really, really important to be clear in our minds. Taking the decision of single motherhood by choice requires values like freedom, courage, and bravery, but other values like tradition might conflict or compete with these first values. So that's actually good to talk to a psychologist to help you. So I wrote some questions that might help you reflect on your decision. The first one is, how important is motherhood from 0 to 10? How important is it? How do I picture myself in 10 years living without children? There are actually no right or wrong answers or better or worse. It's just a way for women to reflect on their decision. Okay. How much time do I have to wait to become a mother? Considering 35 as an age where fertility decreases, and I would recommend for women to do some fertility tests and the exams in order for them to be aware of how much time they have. Am I able to financially provide for a baby without help? Which are the best or worst things of a life with children or a childless life? What would be important to me to hear from others? What do I believe is going to be easier or harder for me while being a solo mother? Will I love me more if I become a mother? Will I love me less if I don't become a mother? How do I understand the concept of motherhood? What defines motherhood to me? Do I feel more mother if the child has my genes and my genetic heritage? Do I feel that a biological child and an adopted child are essentially the same? Do I need to carry the pregnancy and give birth to feel a complete motherhood experience? Am I at ease with the possibility of not having a father figure or a paternal figure to share this project with? Are the hardships of solo motherhood by choice greater than the benefits? Like decisions based fully on yourself, no partner conflicts, regarding education, no separation, custody, regulation, etc. Am I able to encourage myself when things get tough? So the second pillar of emotional support, I think it is self-esteem and self-confidence. I think our personal worth is not measured by being able to conceive or to become a mother. Social and family pressure can make you break and second guess yourself. So you really need to start by accepting yourself as you are. It doesn't really matter what others say or think when you accept yourself. Also, being confident on assisted reproductive technology is not about being positive and calm all the time. It's impossible to be calm and positive all the time because it's a really rough process. Being confident is knowing that whether things get easier or tougher, you trust yourself to get through it and you encourage yourself, and you know you will have the resources to deal with it. So self-care. I think that my job as a psychologist in a fertility clinic is actually helping patients to take good care of themselves. So this is basically my ultimate goal every day, because it's something that really patients forget a little. So your self-preservation and self-compassion will be extremely important during the ART process. It can get physically and emotionally violent. And an ART treatment is a risk factor for perinatal depression. So it's extremely important to take good care of your mental health during the process. In order to be fit to have a baby, you need to first take care of yourself to receive that baby. Of course, eat and sleep well, exercise, maintain a social life. Basic things that can be hard to maintain during an ART treatment. You'll need to respect your body and mind. You need to listen to your body when it needs time or when it needs rest. And you'll need to be aware of your limits, because ART is not supposed to destroy you emotionally. It's supposed to help you and be an opportunity, okay? Also, I would advise people to try to learn mindfulness. Of course, mindfulness is not for everybody, but you can give it a try. It is scientifically proven that the regular practice of mindfulness reduces anxiety and stress, and there are several studies that show that it increases the chances of pregnancy in infertility. Okay, although it should not be used for that purpose. Okay, because if you do it for that purpose, then you're not really doing mindfulness, because mindfulness is something that you do without expecting anything. Okay, it's a self-care way of living. Also, self-care means asking for psychological help if you feel overwhelmed, if self-criticism, intense anxiety, depression, and rumination take over. You'll need a professional approach, and please don't delay asking for help. So emotional regulation is the fourth pillar of emotional support. You'll need to learn how to regulate your emotions, because they will most likely to be very intense during the process. So first of all, you need to understand how emotions work. So emotions are biological and automatic. We don't really control them. We don't choose them. They're like visitors in our body. They are messengers of our private internal experience, and they come and go, and they are really a part of being human. Okay, there's nothing to change when it comes to emotions. So the more you try to avoid or control an emotion, the more intense it will get. So we need to accept emotions. We need to let them do their job. An emotion lasts on average only 90 seconds, so they are really, really fast working, doing their thing. What really maintains an emotion is thoughts. Thoughts can maintain an emotion for lasting hours, months, or even years. That's what happens with depression, for instance. So what are the emotions commonly felt during the process of art? I think the most common emotion is shame, which provides the strongest human suffering. It is proven to provide the strongest human suffering. Shame is related to the fear of not being socially accepted, included, respected, or recognized, in this case as being parents. So a lot of my job is to unshame patients or help them feel unashamed. Sadness is quite commonly present. This is just emotion that is recruited to deal with defeat. And in evolutionary terms, sadness provides a slowdown or even a shutdown of body functioning to just really recover energy in order to prepare for resuming life or changing one's life. Okay, so it has somehow a motivational feature. Then we have fear. We know that art brings a lot of uncertainty, unknown, and loss of control over having a baby, and this is an extreme danger perceived by our mind. Anger is frequently felt, and envy. Envy is actually secondary emotion to primary emotion, sadness and anger. And envy is the fear of being at a disadvantage and feeling the other is not worthy of something. This is just, it's okay to feel all of these emotions, okay? The question is, how do we respond to them, and how, what we do with them? Because there's nothing that should be changed when it comes to emotions. So, how to regulate emotions? This is something that we actually learn on psychology appointments, and it's important for any person actually, and it will be extremely important for a single mother because the baby, the child, will co-regulate their emotions from their mother. So it is very helpful if the mother knows how to self-regulate. So first of all, I recommend to identify the emotions present at the moment, and to put a tag on the emotion, to accept and embrace all emotions present without judgment and with curiosity, to check where are they in your body, which sensations are they producing, where are they in the stomach, in the shoulders, in the head, in the form of a tension, a form of an aching, an itching, how are they expressing in the body, because our emotions express in our bodies. Then we need to validate the emotion. Okay, I'm entitled to feel like this. There's nothing that should be different. Everything is just what's supposed to be. Give space for the emotion to do their job. Don't try to suppress them or to avoid them or to get rid of them. Emotions are temporary visitors. And it is ultimately a choice to act according to the emotion or to act according to our values. I can feel scared and still choose not to be limited by fear. I can feel angry and still not destroy anything. I know I will be able to manage challenges. I have my own back. Okay, so this is, you can also learn some techniques to self-regulate. There are some basic techniques that I usually teach to patients. And of course, it's something that you learn to train. So there are three emotional regulation systems. The drive system is the soothing system, and the threat defense system. They are present in every human being. Okay, it's just that patients during our treatments, they have the defense threat system more activated. This system serves threat detection and protection, and acts by the rule better safe than sorry. Okay, it is triggered by the amygdala, which belongs to our primitive brain. So it's really strong system. And it causes feelings of anxiety, anger, disgust. It's really important for our survival. Okay. Then we have the drive system. It helps us motivate and to take action. It makes us want something, pursuing something, achieving, progressing, focusing. Patients can, during art, they might have this system really activated, or at some point not at all. They feel like it's pointless to continue. Then we have the soothing system, and this system helps to regulate the other two. This is really important to manage distress and to promote bonding, social bonding. It is responsible for feelings of contentment, safety, protection, and trust. So during psychotherapy, and I help patients activate this system, okay? Because during treatments, it is not really working properly. So finally, we have psychological support. Of course, everything that I said before is part of psychological appointments. We go through all these pillars and help patients to build their emotional support. You're not supposed to do it on your own, okay? Psychological support can really be helpful when you are making the decision, when you're considering it, when you're feeling stuck with the decision, to help you build your self-esteem and self-confidence, to learn mindfulness and self-compassion techniques, to deal with the absence of control over the treatments, to learn how to regulate emotions, to grieve genetic motherhood when you need to do egg donation, to prevent treatment burnout, and essentially to learn to accept that we will never be able to control the treatment process or the outcome, but that we do surely can control and transform our relationship to the outcome, and that's where we get our power back. So, what is actually the role of the psychologist when it comes to patients? At least at Ferticentro, we provide the support specifically in challenging moments of the process. We give free support after a negative pregnancy test, after fetal loss, for treatment decision making, as explained before, and for donation and donor selection. We have a specific appointment to help patients to understand donation and to help them selecting their donor. Also, at Ferticentro, we have an integrative approach, which means that we adapt the psychological interventions and techniques according to the needs of the patient, whether it's counseling, classic cognitive behavioral therapy, acceptance and commitment therapy, compassion-focused therapy, mindfulness, etc. It's not so relevant to make a psychological diagnostic. That is not our concern. We focus on enhancing psychological well-being. Also, the predictor of treatment success and mental well-being in our treatment is psychological flexibility. So we base our interventions mostly in the acceptance and commitment therapy. ACT invites us to live profoundly connected to the present moment, to embrace actions and behaviors based on our values, and to live a life with meaning and purpose. This is what ACT means. So ACT, acceptance and commitment therapy, has a model to explain psychological well-being. Psychological well-being is predicted by psychological flexibility, okay? And this flexibility has 6 main processes, which are being present in the present moment, contact with the present moment, clarity and contact with values, committed action to do what it takes to engage in actions that serve our values. It means also to have a flexible self. It means to know that our mind has an automatic and a natural way of acting, and it doesn't really defines us. So just observing our thoughts and accepting them, accepting our internal experience without changing anything. So this is basically what we learn in acceptance and commitment therapy. The opposite of it is psychological inflexibility, and this explains like most of the psychopathology. One of these processes will always be present in almost all psychopathology. Dominance of the future or past, lack of clarity or contact with values, lack of action or impulsivity, attachment to the story of oneself, to the mind's narrative, cognitive fusion, and experiential avoidance. This is actually what predicts suffering and psychopathology. So just to finish, I know I'm a bit I'm taking too much time now, but just to finish, I would like to give you some scientific support. Science has really proven that single motherhood by choice, children born from single motherhood by choice are just as healthy as any other children. So I think it's good to know this. So some general findings. Representations of the traditional two-parent heterosexual family as natural, good, and in the best interests of a child are not validated by empirical studies. Research focused on the personal experiences of intentional single mothers has questioned the relevance of the need of a father figure for a psychological healthy child. So it is proven that family processes are much more important than family structure over the children's psychosocial adjustment. The assumption that growing up in a family without a father is not good for the child is based mainly on research into children whose parents are divorced and who does have experienced parental conflict. It seems likely that any negative influence on child development depends more on a troubled parent-child relationship and not on the absence of a father. And the intention to be a single parent contributes to positive mother-child relationships and consequently to positive child outcomes. And the strongest the attachment to the mother, the less trouble exists in accepting and integrating the information of being donor conceived. Just to leave you with two important studies with single mothers by choice. One of them is from Breweys from the University Medical Center Amsterdam. She compared parent-child relationships, mothers' social support, and children's well-being in single mothers by choice and mothers from heterosexual two-parent families. And she concluded that the study concluded that there were no significant differences in emotional involvement or parental stress between family types. The study did find that single mothers by choice did have a great social support network. There were no significant differences in the children's internal and external problem behavior between both family types. Another study by Susan Gollenbach from the University of Cambridge assessed 50 single mothers by choice and 51 two-parent families and their children, and they got to the conclusion that there were no differences in the quality of mother-child interaction and warmth. There was a lower frequency of conflict between mothers and their children in single mothers than in two-parent families. This is actually very interesting. The solo mothers did not differ from the partnered mothers in terms of anxiety, depression, or stress associated with parenting, maybe because of the social support and because of their emotional structure. No differences were found between the children for emotional and behavioral problems, again, like the previous study, or psychiatric disorders. So overall, this suggests that the lack of knowledge of the identity of the biological father does not have a negative impact on the psychological well-being of the child. So thank you for listening to my presentation on behalf of Ferticentro's team. If you need anything, just write me. Here's my email. So I hope that this could help you somehow. Now I am eager to read your questions.
Thank you so much, Margarida. You took your time, that's for sure, but it's definitely okay. Because I love that you provided some studies at the end as well, and you definitely had some excellent examples where to look for some more information, how to find support. So those are all the aspects that we are definitely finding useful. So thank you so much indeed. Okay, that was a thorough presentation. And I'm sure you've all found it interesting. And now, yeah, it is time for the questions. So there are some comments, okay? But of course, we are here to advise, to support. So let's have a look at the first comment here. Sorry, just give me a second. Yeah, here it is. So sometimes I feel shame because I need to go through IVF with sperm donor, and I'm worried about what people will say about my decision. I guess you have received such comments before as well, right?
Yes, I think that this is maybe the most common concern that single mothers express when they come to the clinic. So it's really part of the process. But we can help you clarifying your values, and this is something that we really should discuss on a psychological appointment, and I will invite you to do so, because it's not something that should impel you from making the decision. Okay, it's something that will not be in accordance to what you want. So you really need to build some self-confidence and to clarify your values. This is my recommendation.
Thank you, Sylvia, of course, for sharing this, and also for your answer to that question, Margarida. And as Margarida mentioned, there is an option for you to get in touch with her. Of course, there is a link where you contact her directly, and I'm sure she'll be happy to help you out as well. Okay. All right. Okay. We have two parts of comments. Okay. So let's have a look.
Okay.
I've been quite surprised how judgmental people have been without me asking their opinion. I've been told by a really good friend that my child will need psychological help because of my choice. I'm very confident in my choice. However, it can be hard having to deal with these comments. So it's similar.
This is really, really interesting because So this woman, she she's really confident, okay, but she has a hard time dealing with unwanted comments. So this might bring some external shame, what we call the external shame, because I think internally she's determined, at least from what I can interpret. I might be wrong, but this can trigger some external shame. Okay, and this is something that actually even women from couples, they also struggle with these unwanted comments. So it is something that you will always happen when you have a child. I don't agree at all with your friends when saying that your child will need psychological help. I think that it's not something that really a friend will say.
Of course. Thank you.
As we saw on the studies, that it's not me saying that, it's science. Okay, so
yes, at the end you provided those statistics there, the studies that show that actually it's not right. It's not different actually. So
yes, a psychological healthy child does not need a father figure or a paternal figure. Okay, it all comes to the relationship between mother and child.
All right. Thank you so much, of course, for that comment as well. And we do hope that it helps, of course. Let's have a look. Okay, yeah, thank you for that. So I will show you in a second, because right now there is one more question that we have. If you have any more, you know what to do. Just go ahead, type those in. And the question is from Kate: when you go for donor treatment, are you offered counseling? Is it required, like in some countries, or only for those who are interested?
Well, at least in Ferticentro, we offer free psychological support when patients, of course, they need to express that they want to have counseling. So yes, you need to tell us that you are interested. We offered it, but only if patients ask for it, we will schedule the appointment. It's not like a standard procedure for every patient that comes to the clinic to do donor treatment. Okay.
All right. Thank you so much, Kate, for your question. And of course, that's reassuring.
I don't know if I understood the question properly.
Yes, I think that, it's not required. If someone wants, you are offering free counseling options, right, as well?
Yeah, it's not mandatory. I know that in some countries it is mandatory. No, not in Portugal. Okay, only if you feel the need to have it.
Of course. Still, thank you so much.
Our doctors also, they offer when they feel that the patient will benefit from a psychological appointment, and they also refer to me. Also, the nurses, all the team can refer a patient to me and can offer the psychological appointment. But the patient, of course, might upfront tell us that, okay, I need to schedule an appointment, and we will do it.
Of course. Perfect. Thank you so much. I believe it was helpful as well. And there are some, of course, as you can see, there are some thank yous coming up, but someone is typing. I just want to see whether it's a question or a comment or a thank you. So I think it is. Yes, perfect. No, sorry, still someone is. Yeah.
Okay.
One more question, sorry. So is the psychological assessment of the donor included? Does it include an IQ test?
It's a very nice question. But I'm afraid that it is not something that we do. I don't know if any clinic does it, at least in Europe. I never heard of it. So the answer is no.
Okay, still interesting question for sure, and thank you, of course, thank you so much for that. I I haven't heard about that before as well, so I guess
Yes, I never heard.
exactly. Thank you so much indeed as well. And okay, sorry, one more from Sylvia. What about a personality test like MMPI? Something?
Well, I'm glad that you came up with this question. I personally think it would be something good to add to our assessment, personality test. But unfortunately, we don't really have. I think there's also a limit for us to ask for donors. Okay, so their gesture is just so great, and the first assessments, the first clinical assessment, it can take up to 5 hours. Okay, so they really have to be dedicated to get involved in this process. And when it comes to the psychological appointment, sometimes we take 2 hours. Okay, and this is something that really demands from them. And a personality test, a good personality test like the MMPI or other, like the one that assesses Big Five, the NEO-PIR, they take at least 1 more hour. Okay, so I agree with you. I would like to do a personality test on the donor, but it's not really feasible. Okay, and we have other sources of information about their personalities, and you can find that in their extended profile. We have a clear idea, an approximate idea of their personality through the extended profile.
All right, of course, that makes sense, right? I guess as well.
Yeah, I don't think that we can ask more from them. Okay,
Of course.
and we have a really thorough and complete psychological assessment of donors. I think that one of the most complete assessments, I believe, from other clinics that I know. So personality tests will demand more from them, will require more from them, and it's not.
There is a limit sometimes.
Yes,
right?
yes, there is a limit, and it doesn't really. It's something that it is. I understand it is important for patients to know the donor's personality, but it's not really important for the child. Okay, for the child, what is important is the personality of the mother. And the experiences that the mother will provide the child, the school where the child will go, the attachment to the mother, the relationship with the mother. It doesn't really matter the personality of the donor. Of course, it matters to discard some psychopathology, okay, like obsessive compulsive disorder, bipolar disorder, any kind of psychological psychiatric disorders, but this is my job. Okay, this is actually insured by the clinic. If the donor is more introverted or more sociable or more benevolent or more pragmatic, this is something that you can easily find in the extended profile.
All right. Thank you so much. I do believe that was helpful, of course. Sylvia, thank you for the question. Definitely interesting as well. And well, as I mentioned, it seems that this is our final question. However, thank you so much, everyone, for joining us tonight, for your questions,
Thank
for
you.
staying with us at this time on Friday. That means that it helps. I definitely think it helps because, of course, this is all important that we are talking about this. And as you can see, Margarida, there are some comments for you. Excellent presentation. Thank you for sharing with us so many interesting things. Yes, agreed on that for sure. And one more, thank you. Great session, some really helpful tips from Claire. Thank you so much for those comments here as well.
Thank you, Claire.
Thank you indeed. And it's been a pleasure to have you here, Margarida. And as you know, sorry, you might actually don't know, but this is Margarida's first presentation like this, right? Webinar. So
yes.
Great job for sure. Thank you so much for joining and presenting this. And you've done an amazing job. And
thank you, Caroline.
Before we finish, anything else you would like to add?
I would like to say that I really, really admire my patients. And I really, really admire single mothers that go for it by choice.
Perfect summary, I guess, right? Thank you so much indeed. And I just want to mention that, of course, this has been recorded. You will have a chance to watch this again. Or if you want to share it with anyone, of course, you will find it on My IVF Answers. There are over 350 webinars right there, so plenty of topics to choose from as well. And if you go to our YouTube channel, again, there are all the webinars are right there as well. And if you subscribe that way, you'll be notified that the video has been uploaded. And as you also probably know, we will be back on Monday. There are more events coming up, and we will be focusing more on IVF legislation in different countries. And actually one more webinar with a team member from Portugal, from Ferticentro, will be with us as well. So go ahead, register already. And I do hope to see you here on Monday at 8 p.m. UK time. And of course, Margarida, once again, thank you so much for staying with us. Thank you all for joining. Have a wonderful weekend. And Margarida, hope to see you soon. Thank you so much. Take care.
Thank you. Bye-bye.
Bye.